Hi, everyone. This is Dr. Teresa Dale. Welcome to Natural Health Radio. I'm your host, and we're going to have a terrific time today. Unfortunately, it's not going to be an entire hour, but we are going to talk about gut health. It's so very important for everyone. And I know that it's on people's minds because I get emails all the time about gut health and what we can do to help our body to function better and help our digestive system. So we are going to be talking about gut health today. And one of the biggest things that comes up with gut health is candida. And people say, well, how can I eat fermented foods to improve my gut health if I have candida? Well, this is really smart because it's difficult to do that. It's really difficult to work on gut health when you're trying to eat fermented foods and you have candida, because fermented foods make candida worse. So we have to look at an alternative and how we can handle the candida, eat fermented foods, and all of that. And that's what we're going to be talking about today. So many people, when they talk about and think about gut health, they think about restoring the microbiome, the natural positive bacteria of your gut. Okay? Probiotics are great. Non-dairy probiotics are the best. Okay, are the best. But that still will not help. It will hurt candida. You know, if anything that's fermented will affect candida. Now, there are things you can do to help candida so that you can get rid of it. Now, many people patients have said over the years, you know, I've been on a candida diet for 10 years. And I still have it. Well, obviously, if someone has been on a candida diet for 10 years and still has candida, then the cause of the problem needs to be found, needs to be discovered, needs to be unearthed, so to speak. So the cause of candida, we're going to discuss this so that you can have good gut health. Because you don't want to be eating a lot of fermented foods when you have candida. It's contraindicating. And if you've been on a candida diet for a long time, and if you have, you know just what I'm talking about, it's very limiting. So in a candida diet, you completely avoid fermented foods and mushrooms and vinegar, and that's even in mustard and ketchup. It's in all kinds of things, vinegar. Right? So we have to completely avoid fermented foods if you have candida. Now, what you need to do, and also yeast, okay? Also, besides mushrooms, yeast, you know, if you, there's so many different things to avoid, and even wheat can be, can affect candida. So and dairy, you don't want to eat dairy if you have candida. So, the point is that probiotics are great. The idea is to have a non-dairy probiotic. It's still fermented, okay? But you have to find the cause of the candida. Without the cause of candida or any issue, it's like crazy making, because you keep doing a candida diet for 5 to 10 years. And it's so limiting, and you go on it and off of it, and it's crazy making. So you should be on a candida diet no more than 3 months, maybe 6 months at the max, if you know the cause. If you don't know the cause, well, let's look at causes. And then you could see what's pertaining to you, and you can get a better idea of where to look in your you know, life, in your body, and what could possibly be causing it. Biggest cause of candida in your body is mercury fillings. Biggest cause. No doubt, that's going to be the cause. You're going to be on a candida diet forever if you have candida. I mean, and many people do and don't know it and don't understand why they're bloated and why they have so much gas, and they have so much digestive issues and maybe even skin problems from candida. So a lot of people don't understand why. Mercury fillings, number one cause of candida. On the same level, another number one cause of candida is that you've been on antibiotics and it's killed all of the good bacteria or most of it in your body, and the bad bacteria has really proliferated, and now you've got candida. Okay. Well, you could have both. You could be on antibiotics and also you could have mercury fillings in your mouth. You could have both. Okay. So first thing to do is to see why you're on antibiotics and try to use natural things to help yourself, like homeopathy, so that you don't go on antibiotics, and get the mercury fillings in your mouth replaced. So those two things will dramatically help you. Then, of course, you can do a natural probiotic that is not from dairy, and follow the Candida diet for 3 to 6 months. If you're doing it any longer than that, and if you need it any longer than that, then you haven't found the cause, or you haven't addressed the cause, or you've been resistant to taking your mercury fillings out. Now, what about a person who has no mercury fillings, hasn't had antibiotics, but has candida? Okay, well, let's look at root canals, which are all the teeth in the bone and everything underneath where the root canal is in the gum is always infected. It doesn't have to cause a problem. You don't have to feel a problem with your tooth, but it will create candida. You will have candida because you have all of this bacteria running around in your body, and all of the good bacteria is rushing to help that area. And, it's just going to create so many problems besides candida. So that would be another thing to look at. Then another thing that can contribute to candida or be a cause is any medication that you're on all the time. Let's say you're not on an antibiotic, but you're on a statin drug. Okay, your body doesn't like that. There's no way your body likes that, right? So it's possible you can have candida from any meds that you were on because your body has to deal with all of those chemicals. Okay, and sometimes there's a buildup. If you're not detoxifying your body, there's a buildup of toxins, and then candida can ensue. So we can have multiple things that we're doing that can cause candida, and that could be why you're on the diet for a year or more. And you feel, a lot of people when they're on the diet, I feel so much better when I'm on the candida diet. Well, it shouldn't be that you have to do that, because the things that you're avoiding have potential benefits, like fermented food, like sauerkraut or kimchi, or things that are fermented that you're eating. Okay. So the things that we need to look for that can exacerbate candida or can just bring on an onset of it are antibiotics, mercury fillings, infected teeth, medications that you're on all the time. Okay, you need to look at that. Candida is not caused from eating too much fermented foods, although you could eat too much of anything that's good, right? If you eat too much and all these good things that you eat too much of, there's some side effects, little side effects. Like if you eat too much broccoli, you can have flatulence from it. If you have too much carrot juice, your skin starts turning orange. So when you start eating too much of good things, then you start seeing the effect. The only thing I haven't noticed that you can eat till the cows come home is vegetables like spinach, non-cruciferous vegetables like spinach, and garlic and, you can have too many tomatoes because the body, it's very yin. If you look at the yin yang or yin yang part of eating, yin foods are foods that are grown high above the earth, like tomatoes, like oranges or fruits that are grown high above the earth, okay? Root vegetables are yang, and you have to have a balance of the yin and the yang in your life, in your meals. So you need the root vegetables, the yang, which is the carrots, parsnips, which beets, potatoes to a lesser degree, but still sweet potatoes, yams. Okay, and then the further foods grow from the earth, the more yin they are. Grains tend to be more, the most neutral grain is brown rice. Brown rice is more neutral, not yin, not yang, but neutral. So if you want to balance your body, and this is something that they teach in macrobiotics diet, you want to eat not too many yin foods because it can be very irritating. And you don't want to eat too many yang foods, so you want to have a balance of yin and yang. A lot of people are allergic to tomatoes, and tomatoes can be very harmful to their body, and they're not aware of that. But all in all, we're talking about the gut, okay? And that's why we're talking about these dietary specific little things that we can do, all right? So balancing the yin and yang diet is very important. Making sure if you have candida that you eat a candida diet and that you don't eat fermented foods of any kind, including yeast that's in bread, and this is to get your gut balanced. The other thing is you need to detoxify. So in order to detoxify, we have certain remedies on our website. We have at Dr. Dale's Wellness Store, we have Candida Ease, EASE. It's called Candida Ease. And that handles the 4 most prevalent types of candida that there are in the world. There are 157 types of candida. The candida diet may not handle all of them, okay? And some of them are specifically known to be picked up in hospitals. Others are picked up in the tropics, another type of candida. So in my formula, I have the 4 most prevalent types of candida. I have the remedies for them all in one bottle. So whatever you have, your body picks out what it needs. The rest doesn't work because your body doesn't need it. So it's a self-regulating formula. It's called Candida Ease. And I would highly recommend that if you have candida that you try that. And that you also consider the slow cleanse. So the slow cleanse will make sure that the toxins and the byproducts and neurotoxins come out of your liver, your kidneys, your blood, your colon. And by the way, this cleanse also really strengthens your immune system. So I would look at that very carefully for candida, which is one of the most important things in looking at the gut, is restoring the proper microbiome, or other people used to call it the milieu. But we want to make sure that we have plenty of good bacteria. You get that from your foods. You can get that from probiotics. And I would suggest a non-dairy probiotic, because dairy is not recommended. Cheese or yogurt or anything like that is not very recommended if you have candida. So, but they have a non-dairy one that from rice, and BioK Plus makes that. You can get Dr. O'Hara's OHARA. His probiotic is extraordinary, and it's in capsules. And you can find that at the health food store. Okay, so those are 2 I'm naming. One is Live, which is very fermented, but still you can get it from rice, not from dairy. And the other one is Dr. O'Hara's, which is in a gelatin capsule, and it's very effective. And we don't have it's not a big fermented process that is incorporated into that formula. So those are the two that I like and I recommend. But I always test it on the patient. Now, I can't test you because we're on Facebook Live and we're on Natural Health Radio. But what I'm saying is you can use those two ideas that I gave you to find what you need and start working on your gut. The other thing about the gut is there is an innate intelligence in your body. And that innate intelligence is affected by your emotions. Let's say if you stuff issues that come up in your gut, in your colon, in your large intestines. Now, how would you know that? Well, you know that by what I'm going to tell you. The emotion related to your colon is feeling stuck. So if you feel stuck in anything about your life and you've been feeling stuck on and off for years about the same thing or other things that are related, then you could have a colon problem in candida from that as well. Okay. Now, for the small intestines, the emotion related to that is vulnerability, being overly vulnerable. This is according to the 5-element theory of Chinese medicine, which is your most accurate diagnostic medicine. It's acupuncture, okay? And it's accurate, what I'm saying. So small intestine is feeling vulnerable. So if you're feeling stuck and vulnerable, even if it's about different things, and then your liver is related to anger and frustration and rage, and then your stomach is disgust and despair. So those things need to be looked at. If I were you, I'd do a free self-test. You can go to wellnesscenter.net. At the very top, you'll see a little green bar going across, and it says free self-test. Click on that. You'll see a candida test. You'll also see a test for digestive gallbladder. You'll see different tests there that you can take, and you'll see a neuroemotional remedy test or neuroemotional survey. When you do that neuroemotional survey, right in front of you, you'll see what percentage of the time in your life or in the last month, however you want to look at it, because there's a theme going on in your being. Okay. What percentage of the time you feel stuck? What percentage, and what do you feel stuck about? What percentage of the time do you feel disgusted or in despair? Or do you feel vulnerable? And vulnerable can be a good thing, but it also can be a not good thing, because you can be overly vulnerable to things that are not good for you. Like if you are addicted to drugs and you have a vulnerability there to take it, not say no, to not be focused on making a change because of your vulnerability. Okay, so you need to look at those things. Do the neuroemotional survey, and then you'll see for yourself what you have, and then you could take a remedy to work on those things. It's as simple as taking a remedy to work and release those things from your body. That's all it is, right? And it's important because your gut is depending on you working these things out. So, I mean, you could take probiotics for many, many years and be, wanting to take them, loving them, feeling like they really help you, but why do you really need them all the time? So I know that, as far as myself, I take once in a while, I take a probiotic, not because I feel like I need it, just because I feel like, it might be good for me to take this little probiotic today. I'll take this today. And that's the way it goes, but I don't need it. And so some people react to probiotics if they don't need it. And they have loose stools from it, and they have gas from it because their body doesn't want it, or it's the wrong kind. It's something. So we need to find the right things for each of us because we are all individually so amazingly different. And we all have such an amazing body. And each one of our bodies is different and responds differently to different things depending upon your emotions, your dental, what your diet is. Okay? But Candida should be a no-brainer here. You shouldn't be on a Candida diet for a long time. And you shouldn't need to take probiotics all the time because then there's something wrong. If you say, well, I have to take probiotics every day or I get this problem or this problem or this problem, then there's something wrong. Either you're on a lot of antibiotics or you have mercury in your mouth or you have an infected teeth. It's some problem that you have not unearthed and looked at. And since you are the master of your body, since you know more about your body than anyone else on the planet, it seems fair, it seems logical and accurate that with a little bit of research, you'll know exactly what to do for yourself. And I want to encourage that because people run to the doctors too much. They think the doctor knows more about their body and some test is going to tell you about the anger that you've been feeling for 20 years. It ain't going to happen, fellas and women. So what we need to do is understand we are the master of the temple that our body is, and that we just need a little bit of education in order for us to hone in on what's good for us. And that is called empowerment. So I could sit here all day long and give you things to empower you, but if you don't empower yourself to make the right choices, then it's a lot harder to empower you. Okay. And a lot of the things that I say, maybe you think, oh, this sounds good and all of this, but you actually don't do it. So there actually has to be an action step. In my book, Revitalize Your Hormones, I have action steps at the end of each chapter. And those action steps are to help you deal with any resistance that can come up. And it could be anything. It could be you're resisting getting your dental thing handled because of money. And that's a real thing because dentists are expensive. However, many of the dentists today have dental plans where you can go to the dentist and they let you pay them off in time. And that can work instead of insurance because most insurance doesn't cover dental. Why? I don't know, but they don't. I mean, even if you buy a dental plan, you only have to go to their dentist. And what if their dentists are like really not good and would create harm in your body and don't include biological dentists? So you need to go to a biological dentist and make sure you get a payment plan if that's what you need. But there's always an answer. So resistance doesn't have to be an ongoing thing. Okay, you can just do it. Look for the answer and then do it. And that will help you heal yourself. I love talking with people who have healed themselves. And, I would actually love to have some of them on my radio show. If you could come out to my studio in California, then we could have you on. I would love to talk to people who have healed themselves of disease and how they found out what the problem was and all of these things. And I know for a fact that people have cured themselves of cancer. People have cured themselves of all kinds of cancer, including melanoma. And they use diet and they handle teeth and they learn and they do all these kinds of things. Now, I'm not saying that is the right thing for you. I'm saying if you want to do that, you got to be very educated and you have to You have to search and find answers and learn about ozone therapy and learn about so many different things that would help you. Okay? I'm not saying that's the answer for everyone. I'm saying that I know people who have, after the fact, I know them, I never knew them before the fact, but on their own became educated and decided to do it, and it worked for them. And because of that, they are incredibly powerful, kind, healthy people because they learned how to handle whatever comes up in their body. Okay? Now, most of us need help from time to time to do that. Just make sure the help that you get is non-toxic and that you don't go under the knife unless you feel it's the right thing to do. And you have all the right and in the world to say yes to doing that and then to decide differently before you do it that you don't want to do it. You have the choice, you have the option to change your mind. If you set yourself up for, doing some procedure, okay, and then you think and you do some education and you go, oh my God, what am I doing? I don't want to do that. But sometimes people say, well, I already have it scheduled and I'm afraid to tell the doctor. It's your life. Shouldn't be afraid to tell anybody. It's your life. You do the right thing for yourself. Whether it's yes, the surgery is what I want, or it's no, I wanted it, but now I don't. Or I don't want it at all. I never wanted it. And I think I can handle it and fix it. Whatever the scenario is, this is your life. This is your body. You were born a powerful person. You were born with total health freedom. You were born and still today have total health freedom unless you take that away from yourself. Now, if you do that, that's not a nice thing to do to yourself, right? Because it is your option. It's all your choice. It's all your option. So coming from that perspective, what I'm going to do is continue after a break, and then I'm going to, we're going to cut short this Facebook today, Facebook Live. I'll see you next Tuesday at 1:00, but we're going to continue on the radio today. So we've discussed a lot of information about gut. Maybe there's just one more thing that I can do, and that would be to talk with you about one thing. It's like the big elephant in the room right now. It's parasites. Most people with gut problems have or have had parasites. Difficult to get rid of. You can get them from going out to a restaurant drinking water in the United States and California. You can get it from someone else. It can be passed on from one person to another in saliva. Okay, you can get it from other people. You can get parasites from food. People's hands are not clean. You can get parasites from traveling anywhere, not just a third world country. You can get parasites from going to Switzerland, Germany, or anywhere that someone has to handle food and isn't using gloves. Or if they use gloves, they touch something or, before they touch the food, but they have the gloves on. A lot of people don't know. You got to change those gloves every time you're stopping to work with food and go to the cash register. You need to change your gloves. They need to change it. Okay? So parasites are a huge problem for gut health, and Candida goes along with that. Okay, that's so you have to treat the parasites and you have to treat the Candida. Okay, you have to also look at the mercury in your mouth, because why do you have parasites and the next person doesn't? It's because you have a faulty immune system. It's because your body can't handle stuff, whereas another person could have eaten the same thing, drank the same thing, and they didn't get it. This is Natural Health Radio, Dr. Teresa Dale, and we are talking about the gut. So one of the most important things about the gut, as I mentioned earlier, is parasites. There is a formula that you can take, and you can go to drdaleswellnessstore.com and look up ParaPro, P-A-R-A-P-R-O. ParaPro will kill any kind of parasite. Doesn't matter if you have Cryptosporidium or Blastocystis hominis or some kind of parasite that you don't even know how to say, ParaPro will help kill that. Now, if you have toxoplasmosis or which is from house cats, because that's a parasite that lives in a house cat. If you have that, then you would need a different remedy that is homeopathic and specifically focused on that. So what we need to do is understand that there are multiple answers to something. If a person gets malaria, cholera, then you would use a homeopathic remedy. Toxoplasmosis, you would still use the ParaPro, but you would add a homeopathic toxoplasmosis remedy. And lots of people have toxoplasmosis from their cat, now which is genetic in cats. If you have people say, when we do testing, we test by blood for toxoplasmosis, and they show up positive. And they say, and I said, do you have a house cat? And they go, yeah, I have a cat, but he's an indoor cat. And I said, I don't care if he's indoors or not, but this is what it's showing, and it shows toxoplasmosis. So I can tell you, even if your cat doesn't go outside, it's genetic in them, and if they're on your kitchen counters, if they're jumping on your toilet, if they're sleeping on your pillow, some people have, Daryl just made a face about jumping on your toilet.
No, toilet and the counter.
Yeah, and the counter,
too, yeah.
Okay, so the thing is, some people have trained their cats to go potty in the toilet. People do all kinds of things. The problem is if they have toxoplasmosis, you're going to get it from them. You can get it from touching them and then touching your food. With animals especially, as much as I love dogs, I like cats, but I'm more of a dog person, so to speak, because I've been around them more. I can tell you that they have parasites. You can get certain parasites from dogs. It's possible. I grew up thinking that because my mother had told me that a dog's mouth is cleaner than mine. And it was wrong. It's wrong. Absolutely wrong. I grew up having pinworms because of being around the dog's mouth. Okay? So there's things you can get. All right? And I'm just saying, I love dogs tremendously. They're like my best friends. I would rather be with dogs than with humans most of the time because they are woman's best friend and man's best friend. Okay, and they're fun, and they put you in a very fun place, and you can, playing and all of that. It's great, but there still has to be sanitary things that happen in your home, and so it's very important to take care of yourself. Find out if you have parasites, if you have a gut problem. You can do a stool test. Sometimes they're not accurate. Sometimes they don't show up unless the stool sample is done the right way. I can tell you, if you do a parasite test via neurophysical testing or kinesiology or electrodiagnosis, it will be more accurate. It will be, the testing that I do in my office, I could tell in 10 minutes if you have parasites or not. It's just a very simple body reflex system that tests for weaknesses and strengths. And you can test vitamins on your body, and you could test remedies on your body. You can test all kinds of things to assess the body. It's a great assessment tool. It can't be a diagnostic tool because it doesn't tell you the kind of parasite that you have. It can just tell you if you need the remedy for parasites, which is good enough. Because if you test for an herbal parasite formula, you can be sure that your body needs that. Okay, so from that perspective, from a simple assessment, neurophysical testing is dead on accurate, and it always works. So you can check that out if you want to do some more research in our wellnesscenter.net members area. You are welcome to do more research about that. I suggest you become a member because that's where you will educate yourself. You will educate yourself about Candida, about healthcare, parasites, whatever is going on with your body. Okay. You will find information about that on our website in the form of articles, audios, videos. And we have links to perhaps a webinar if you'd like to become more educated and take an hour webinar. We have all of those educational tools available for you. Now, the neurophysical testing, I train health providers to do that with their patients. It is a phenomenal tool, and it can help educate you about the patient's body. But if you can also do it on yourself. And if you learn to do it on yourself, you can test yourself. Think about the freedom in doing that. So we want to empower you. I want to help empower you. I will be a big help if you want to empower yourself. If you don't want to empower yourself, then I will not be a help at all. But if you want to empower yourself, I'm your gal. You tune in here every week and we'll give you more tools. And also, you can go to wellnesscenter.net, add to the educational areas that I discussed, as well as Dr. Dale's Wellness Store. And you can take a look at our products. Our detox products are so very important. And if you're really turned on by this, if you're really passionate about healing, then you could go to the California College of Natural Medicine, www.cconm.com, www.cconm.com, and you can learn about our entry-level trainings and our professional trainings for health providers only. So we have both. We have entry-level trainings for people who have healed themselves, they've healed somebody else, they want to learn natural medicine, it's helped them tremendously, and they want a change of career. You want to go there and look at all the great entry-level trainings we have, like our clinical nutrition training or our homeopathic medical practitioner training. And you want to get educated. You want to get educated. Our trainings are online and residential. Residential means that it's in person. So we have most of our trainings are online, but we do have oftentimes a residential component of a training so that we can get to meet. And whether it's on the phone in a webinar or it's in person, I invite you to become as educated as you want to be. And there's nothing really stopping you except you. I mean, you're the only one who's going to stop you. And people do that to themselves. I've done that to myself many years ago, where I've stopped myself from doing certain things that I regretted later on. Well, now, see, it's a different time in your life, and maybe you decide, oh, I don't want to do that anymore. Now I want to become educated. Now I want to learn everything about how to heal the common cold naturally. Or I want to learn everything about helping my structure because I have a pain in my hip, and I don't want to have surgery, and I want to find out how I can help the pain go away simply. You will learn so much. You will learn a lot by becoming a member of the Wellness Center, our Wellness Optimization Club, which allows you the opportunity to go to your own dashboard where you will have access to even more and different audios, videos, and protocols and things you can't even imagine right now that are there for your education. It's all about education. That's what healing is. It's about educating the patient and how to make a healthy life. So we want to make sure that you have the knowledge that you need. And that's why in the members area, there is a link that you can click that says Ask Dr. Dale. And from the members area, after you're a member, you can click on that link and you can ask me questions. And then I will get back with you. It may be necessary for you to have an appointment with me, and it may not. Most of the time it's not. And I would rather teach you and through the appointments that you may have with me, it's educational. And so whatever we do, I would rather see that education is a huge part of it. I don't like just telling people what to do. I want to teach them why they're doing it and all the things that they can do to make everything work the best it can be, so that whenever you try something, whenever you do something natural, whenever you change your diet, whenever you're treating candida, whenever you're treating parasites, that you know everything to do so that it works and you can feel the difference. That's the key, isn't it? I know that's what you want. You want to be able to, when you try something, why spend the energy and do it if it's not going to work? And I know you're with me on this. So in order to make it work, it's not about just taking a pill or just eating a diet. It's about all the other things that you should be doing to not only make it work, but make it permanent. That's right. Permanent. That means that you would have cured yourself if you have permanent results, doesn't it? And that's what I'd like to show you how to do. So all you need to do is go to thewellnesscenter.net and then click on member. And then you will read about the membership. You will see that it costs $20 a month. And you can do that for as long as you like, because that $20 a month will be part of your education, and you will find plenty of material to read and to learn for a long time, maybe a couple of years, to get through all of the information in there if that's what you want. And then, of course, you can make an appointment with me through the members area, or before that, you can just ask me a question. So my feeling is the membership is key for everyone listening. And we do have even health providers who are members, and because they want to talk with me about their personal information. So I want to empower you to make the right choices. In order to do that, you have to know what your choices are. It's not just a choice between eating vegan or eating non-vegan. It's another choice. There's many other choices, like the choices are getting your mercury out. And what do you replace it with? You have choices. There's choices in everything, okay? So what do you replace it with? Do you replace it with a composite filling, which I wouldn't recommend? Do you replace it with porcelain? If so, what kind of porcelain? So there's a blood test that you can do at a biological dentist, which tells you which substances you're most reactive to and which ones are healthier for your body to use. And so there are things you can learn that will put you in charge, and you're always going to have good success. So a lot of patients have said, well, what do you do, Dr. Dale, when you go to the dentist? I said, well, when I go to the dentist, I test my teeth before I go, and I tell him to look at a certain tooth. And if we have to put in a new onlay on top of the tooth, And then I test the material. I could test right in his office, and he can give me all the samples he has, and I test the one I want him to use. And I do that, and then I test the cement that he used or the temporary. Everything that goes in my mouth is tested. And you know what? I would love to share with you how to do that, because I can't be at the dentist with you. Now, what some patients do is they go to the dentist, they get samples, they bring it to me, and in my office I test to see which ones are the best ones, and they just have to give you enough samples so we have enough choices, and then you have a perfect success in what you're doing, and you don't have any toxins in your body. So in the few minutes we have left, I want to remind you that you can call us at 800-219-1261. And I have a wonderful person at the phone lines that can answer questions about the products and answer questions about the memberships. So what you want to do is reach out, communicate. You're always welcome to do that. I love hearing from people. You can become a member. You can go to our website and read the articles about hormones and hormone rejuvenation and all of the hormone rejuvenation products that I have that are non-toxic, that will detoxify all the toxic hormones that you've had, including bioidentical hormones. All of that stuff is toxic. You need to detoxify your body if you've been on hormones. Go to our website and learn more about it. Check out our products, give us a call, and let us know how you're doing. And next week, we are going to we discussed gut health today. Next week, we're going to discuss a lot more about hormones and new information about your diet and hormones, about so many different things that you really can't miss it, because it's going to expand and expand your knowledge and empower your life. And that's what I really love doing. When it comes to having a business, having a company, that's one thing that's just wonderful. And I feel very blessed. And I have developed 150 products, and I love doing that. But what I really love is working with you. I really love seeing clients, and I love teaching, because that is the rewarding part that gives me the opportunity to get feedback and to learn about your body, which may be just a powerhouse of information, because every person that comes in that I work on, even though they may have the label of the same illness that someone else has, like someone else could have the common cold, you could have the common cold too, but it still has the same name, the common cold. But what makes that happen in your body is different. So it's just a wealth of information that I learn and that people learn when they come in, and we get to discover the cause of any condition, and that is emotional, mental, physical. We need to find out the cause, and that's the key, finding the cause. And we're going to work on that more next week. Many blessings. This is Dr. Teresa Dale, Natural Health Radio. See you next Tuesday at 1 o'clock. Bye-bye.